So I'm going to start out with a little bit of numbers just to catch everybody up, if we could. So again, our dashboard, which is on the coronavirus.ohio.gov, as well as a lot of the other addresses and websites you hear about, we always try to put them all in one place for you at coronavirus.ohio.gov, is our dashboard, and we are now at over 1,900 cases. And many hospitalizations, 475. Remember that we are testing right now with our limited testing. We're testing the sickest and our healthcare workers and highest at risk. So of course those are going to be folks who are more likely to be in need of hospitalization, and we're seeing that in our numbers. 25% of our cases have actually been hospitalized, and about 8% right now are requiring ICU, higher level treatment like intubation and ventilators. I'm very sad to say that we now have 39 deaths in Ohio. Those have ranged, right now the deaths span 19 counties, so that is information I've just received. We do have cases in over 70 counties at this point. We have 88 counties in Ohio. Let's go ahead and look at our next slide. Also, at this point, we know that we've tested about 27,000 people in Ohio. That's still just the tip of the iceberg. We are maximizing our testing, as the governor said. Make sure if you're a hospital and you're testing someone, if you want it turned around quickly, you can get it. We have a couple hospitals, you know who they are in your region, who can do the testing in-house, or you can also send it to my lab, Ohio Department of Health. It's on our website. We can get that run for you in 8 hours. It takes us about to run a test, and that time is getting shorter all the time. So it's really important. We don't want to wait that 5 to 6 days. Next slide. Again, this is just showing that a huge percentage of our cases in Ohio are requiring hospitalization. This is our curve again. We've talked a lot in the past. Last time I was here, we talked about the hurricane analogy for our modeling. Our forecast, our weather station gets a little better each time. The more we feed data into this model, the more accurate it gets. And so we're feeling that they're getting some pretty good numbers. It gets better with each day and more accurate, but we still see that our peak is going to be, we are thinking in a couple of weeks. We're seeing it more toward mid-late April. Depending on how successful we are with our staying at home, with the social distancing, that might push that out a little further. But we know, and we already see from the stories from the front line, it's a lot of work right now in ICUs and hospitals. They're really already seeing this. We're certainly seeing a lot in our front line workers, especially in nursing homes. Next slide. We're also tracking as best we can, because there's not great accurate data out there, and I'll share this with the media, and we'll keep sharing with you what we have as we have it. But this is a graph, which will be on our website. It's talking about different levels of PPE, masks, and what our hospitals have right now. And as best as we can tell, we have the amounts of currently available. And when you look at the yellow, that's where there's already critical shortages. And this is just going up to their typical 100% occupancy. What the general and I are working on with all our hospital CEOs is basically doubling that capacity again, at least doubling what they already do. And with that, they need all the increased equipment, all the increased staff, and of course the locations. So that's a little bit of a map of where we are currently. Next slide. Similarly, looking at this line up here is our current capacity. We know we need to double that. We don't have exact numbers because, again, we can't put exact case numbers in yet. But we know right now, currently, the hospitals have done a great job of freeing up the equipment by not doing elective surgeries. Right now, it shows you that, for instance, we're at 54% occupancy across, it varies by hospital, on our med-surg beds that are in current use. 30% of our ventilators currently are in use. Now we need to free up all the way up to 100% and then go up to 200% is our goal. Next slide. So I'd like to talk a little bit more for a moment about what we're working on. I know we've talked a little bit about regional plans, and I think that sounds like a very concrete thing, like there's this one blueprint for how our hospitals are acting. In truth, no hospital system in this world has ever faced what we're facing around the world with coronavirus. And so when we say plans, what we're really doing is ongoing, ever-evolving planning. And that isn't a static one answer or one fits all. It will actually continue. Our planning will go through the surge, and it will continue after the surge, and will continue after we start to return back to normal life. We are never going to work together quite the same, to be honest. And we're learning a lot as we go through this. First of all, typically hospitals, I'll use Columbus as an example because it's where I live right now, here in Columbus. We have several hospital systems. We have things like the Ohio State. We have a VA hospital. We have nursing homes. We have long-term and residential psychiatric facilities. All of these work, and they try to collaborate across those systems, but they're collaborating just in one city. They also have branches of their hospital that have much larger containment areas that go out into many cities. And throughout Ohio, we have these systems, and there are local, small hospitals in rural areas and suburban areas. They all connect to each other, but now they're having to connect each other in different ways than they ever have. And what I'm so proud of is the CEOs of all these hospitals are working together to create a master system. That's what I'm spending my time working on. How do we work together as one state? We're no longer saying you're my patient or you're their patient. How are we going to maximize our resources? What are we going to build out at the local level and in the bigger urban centers, whether it's having some centers for more mildly ill folks that might be a build out of something like a convention center, like an IX or Duke. Maybe we're using nursing home beds in slightly different ways. Maybe we're using hospital and hotel rooms differently. Maybe we're using dorms. All of that is in progress. There is not one final answer, but that is what we're working on 24/7, is sort of how we maximize these. And we're working closely with our civic leaders. We're working closely with our nonprofits. So when we say, and when the governor assigned us a plan and a deadline, I think that might have sounded like there was like this finishing line. And in fact, there isn't. In fact, we're building, and evolving. And we'll share with you as we do that more and more detail as that emerges. But that's to say, back at the EOC, our job in government is to help these hospitals as best we can, remove barriers that are in their way. Perhaps there's issues around licensing and getting some of our nursing and med students out there. We'll help with that. We're there at the control center, working closely with those of you on the ground to get you the resources you need as we have them. So that is part of an ongoing, really one system, one health approach in Ohio. And we're also working with our neighboring states, governors, and their hospitals. So we have people that live in Ohio, but maybe work across the border in Michigan or Kentucky, and all of that has to talk to each other, and that's the system we're building. One last thing. Someone has told me that it is Doctor's Day, which, of course, I didn't know, Governor, that there is such a thing. I had the opportunity to watch this press conference yesterday from the EOC. And it got me thinking, and my husband shares a little bit of what he's seeing out there. I have the honor of wearing this white coat, which I know has become a little bit iconic, but it became very clear to me that I'm wearing a symbol of all my friends and colleagues and your family members who are out on the front lines. I'm thinking about you a lot, more than I can express, because I've spent many years on the front lines and sometimes feel frustrated that I can't just come in there and work alongside of you in doing this bigger picture planning. But this white coat represents all of you. It's Doctors' Day. We're losing people. In these deaths, they're starting to be personal. I know we lost an ER nurse. I just learned this news yesterday, who was working, again, a younger person who has a family, working alongside her colleagues, and their colleagues had to help her when she got sick. I know we lost someone from one of our health boards, one of the boards of health members, and all of this is personal. It's becoming increasingly personal to all of us. And so I just want to let you know that I'm wearing this coat, and I'm thinking you every day I put it on. So thank you.